We as parents or potential parents all want what's best for our children. Everyone wants to have a healthy mother and a healthy baby after delivery. And one of the best things that we can do as mothers is to breastfeed our kids. I'm a certified OB nurse, and I've been a labor and delivery nurse for 28 years now. I do labor and delivery, I work in postpartum, and I work in newborn nursery. And during those 28 years, I've helped many, many women learn to initiate breastfeeding, and I try to help them be successful at that. I'm also a mother of four kids, which I had breastfed when they were infants, and I feel like I've been successful at that as well. Today, I would like to talk to you about the health and emotional benefits of breastfeeding your infant. First, we're going to cover the health and emotional benefits for mother, and then we're going to go into baby. Let's first start by looking at the benefits for the mother. Mothers that breastfeed their babies experience many benefits, both mentally and physically. Mental benefits for breastfeeding your baby include decreased anxiety and decrease in stress. According to Alana Blyco, in the article published in June 2005 in the British Journal of Midwifery, women who breastfeed release a hormone called prolactin, which is responsible for milk production. This hormone, also, when it's released, also has a calming effect for the mother, which decreases stress and anxiety. According to Alana Blyco, women who breastfeed also have an increased parasympathetic response. The parasympathetic response calms the body down, opposite of the sympathetic response. This hormone calms the body down. When a woman breastfeeds her baby, it also creates a special bond between the two, which decreases stress. Breastfeeding also has many physical benefits for the mother. According to the Journal of Nutrition and Clinical Care, the article entitled Benefits of Breastfeeding in 2003, women who breastfeed will have increased amounts of the hormone oxytocin. This hormone stimulates the uterus to contract. When the uterus contracts, you have a decreased risk of postpartum hemorrhage, and it also returns a uterus to a pre-pregnancy state quicker. According to Alana Blyco, women who breastfeed have a 22% lower breast cancer risk than non-breastfeeding mothers who are premenopausal. She goes on to say later on in the article that breastfeeding moms have a 20 to a 25% decreased risk of getting ovarian cancer if she breastfeeds her infant for 2 months or greater with each pregnancy over the non-breastfeeding mom. According to Gamal Journal of Medical Science, April to June 2017, additional benefits of breastfeeding include decreased obesity, decrease in diabetes, and decrease in heart issues later in life. Exclusively breastfeeding your infant will delay ovulation, and if you are not ovulating, then you're not getting pregnant. So it also has some benefits going towards birth control. So let's review over the benefits for mom. So benefits for mom: decreases anxiety and stress, more bonding with your baby, mother's body returns to pre-pregnant state faster, decreased risk of breast and ovarian cancer, decrease in obesity, diabetes, and heart issues later in life. We have now looked at just a few benefits for the mother. Now let's go and look at some benefits for baby. According to the American College of Obstetrics and Gynecologists Journal, February 2016 issue, infants that breastfeed have a decreased risk of contracting infectious diseases, and they are less likely to develop metabolic disorders like diabetes. When comparing breastfeeding babies to formula babies, the babies that were breastfed had a stronger immune system. According to the Journal of Nutrition and Clinical Care, December 2003 issue, human breast milk contains many factors that help the infant fight infection. These factors put the breastfed baby at an advantage over the bottle-fed baby. So mom will have less missed days at work because her baby has a stronger immune system. Also, according to the nutrition and clinical care research, is showing that breastfeeding babies will help strengthen the immune system earlier in life. So they have a stronger immune system at a younger age. So the breastfed infant will have fewer illnesses, including ear infections. An example of this would be if a mom was exposed to the flu virus. Her body will build up an antibody to the flu virus, and then when she breastfeeds, she passes that antibody off to her newborn baby. So her baby will develop an antibody to the flu virus, and the baby shouldn't get the flu virus. Infants who are breastfed have shown a reduced risk of developing chronic diseases as well. According to the Journal of Nutrition and Clinical Care, October-December 2003 issue, breastfeeding may decrease the risk of developing diabetes, childhood cancers, and bowel diseases. Being breastfed has also been linked to decrease in allergies and decrease in childhood asthma. With continued breastfeeding, these infants tend to have less obesity in childhood as those compared to bottle-fed babies. So now let's review some of the benefits for the baby. Benefits for babies. It strengthens the immune system. They have fewer illnesses. They have a decreased risk of developing diabetes, childhood cancers, and bowel diseases. Diseases decrease in asthma and allergies, and they are less obese than the bottle-fed baby. I hope my speech has enlightened you on some of the benefits of breastfeeding, both mental and physical. My purpose to giving this speech is to help educate potential parents on the advantages of breastfeeding. According to the Maternal Child Health Journal, July 21st, 2016, only 22% of women follow infant feeding guidelines. And I know that as a country, we can do better than this. We owe our moms and our babies more. Thank you.